Hi, I'm Dr. Rathnadevi. I'm a senior consultant radiation oncologist, specialist in proton therapy and cyberknife services. I'm attached to Apollo Proton Cancer Centre and Apollo Cancer Centre, Thenambet at Chennai. The trends I see with radiation oncology, the evolution of radiation oncology has been tremendous in the last 2 decades, I would say. From the era of cobalt, now we have moved on to proton. So, there has been always a beautiful evolution which was happening in the field of radiation oncology. From cobalt, we moved on to LINAC, and then with the LINAC based, we went from the 2D technology to 3D-dimensional conformal radiotherapy, and then we moved on to the high precision inverse planning with the IMRT, image guided radiotherapy, and then we went with the rapid arc technology. And then we moved on with the radiosurgery with the cyberknife kind of technology from gamma knife to cyberknife, and now we are with the proton therapy. So, the evolution has been, I would say, it has been very beautiful both in the external beam and in the internal therapy. Brachytherapy is the internal therapy, which is another special big branch in the radiation oncology. Brachytherapy, the internal treatment, it is a Latin word, brachy is a Latin word which means close to or at the surface or inside the cavity. We have moved from the LDR technology to the HDR, high dose rate, iridium 192 technology. So, I would say it was a beautiful evolution in the field of radiation oncology. When you want to compare between photon and proton, though they both similar in rhyming, photon and proton, they are two very different from each other. Both are radiation oncology techniques. Photon, that is where I was talking about the high precision treatment like IMRT, IGRT, rapid arc or the volume based technology, and then we were talking about radiosurgeries. All these come grouped under photon treatment, which is LINAC based treatment. It is a very efficient form of treatment in the cancer treatment. It plays a major role in the treatment of solid cancers in a very, very effective way. The sophisticated one is the proton treatment. If you look at the advantages and the advances between a photon and proton, I have a lot to tell you about it. In a proton beam radiotherapy, it is very, very good in certain cancers. What are those? Especially with the pediatric cancers, I would like to make a special mention. Why in pediatric cancers? Pediatric cancers, when the children are very delicate at the age they get this cancer, and when we treat with the proton therapy, the low dose volume, that is the normal healthy tissue adjacent to the target volume, is getting less exposed with the proton therapy, thereby less side effects during the course of the treatment. Also, main thing is second malignancy, because of the low dose rate, that is the healthy tissue being exposed, which happens more with the photon therapy, is bridged in the proton therapy. So, the risk of developing second malignancy, especially with the childhood cancer, is very less. I think this is one fantastic invention, or I would say it is a beautiful advantage in childhood malignancies. Other thing which I would say proton is very good is in the re-radiation. And then coming to the female related breast cancer, if you see left sided breast cancer, the heart and lung is so close to the target volume, and since proton has no exit doors, these organs, these critical organs are not exposed, and I think it is a good beneficial aspect in case of these kind of tumors. What are the challenges I face as a doctor in this field? Yes, I see many challenges. One is on the finance. Patients really struggle to arrange for the finances, or as you know, the cancer treatment are expensive, especially when we go for more and more sophisticated technologies for the benefits. It becomes very difficult for the patient, especially I see that commonly with the pediatric patients. They want to do all the best for the child, and they know there is a definitive benefit with these kind of treatment, and the parents are young and they do not have enough savings. There is a difference between a 20 or 25-year-old young father to mobilize that. First he has to emotionally understand that the child is sick and needs more treatment. Number two, they have to mobilize that money. Whereas compared to a 50-year-old man who has lived a nice life and with a good saving, it may not be that much of a struggle as a young parent suffering for the child. Other challenges is day-to-day treatment. As a doctor, what I see is day-to-day treatment. Day-to-day treatment, small children, we will have to keep them immobilized during the treatment. That means every day I have to give a small dose of anesthesia and immobilize the child and then treat. This is again a challenge which we see every day in our practice. This is all about the pediatric cases, I would say the difficult challenges which we face. Other thing, the other challenges apart from these is the very word cancer itself. So, although we all know second leading disease in the world is cancer, still when you reveal that yes sir or madam, you are affected with cancer, it is a real challenge. And to counsel the patient, walk through the treatment or to the journey of the treatment again is another challenge. And the support system, I mean the support system is the family and the social from the office or from at home. That again is another challenge. Other biggest challenge, especially with the head and neck cancer, especially if there are people like lawyers and journalists or doctors where talking is also very important, and that patient gets affected with a tongue cancer or a vocal cord cancer, the quality of life after the cancer, and that is a major challenge I see as a radiation oncologist. So, although the cancer number is increasing, so is our science increasing. We are really having a big fight between the cancer and the treatment. I would say we are on the winning side, and we are able to do things which was not possible before. Like 20 years back, if there was an oligometastasis, stage 4 disease, we would still say only palliative treatment. Now that scenario has changed. We are making an attempt curative either in the form of surgery or a precision radiotherapy or with a radiosurgery or with increased targeted therapies, which is a development in the medical oncology field. So, I would conclude, though there are challenges which keeps us more alert and brings in more and more new ideas, and we are able to cope with the situation.